mentioned earlier they're going to be in denial.
Yes.
They're not going to want to tell you that they're doing anything's wrong. They're not doing anything. What do you do on that case? It's got to be difficult. I mean, how do you get them to start looking for help?
Very good. So that's a great question because, this is in my profession, I know how to deal with denial. And, but people in general are not psychological professionals to have the tool set, if you will, to, immediately detect the denial and work with it in an effective way. So if you are someone who have a loved one that, suffering from some kind of addiction and they are in denial, and it's kind of crystal clear based on all these symptoms that we have discussed or you have researched somewhere, then the best thing to do really with that stage of denial is to help that person to kind of contemplate about the pros and cons, their options, and the goals that they have in life and whether or not they're achieving it. So it's an honest, heart-to-heart conversation without criticism. So rather than calling a person out on denial and telling, well, you know what, you're in denial. No, you don't want to do that. What you want to do is, like I said, that heart-to-heart conversation, sitting down and helping you explore, again, contemplate. That's a key word. And in fact, in terms of the stage, what we call the stages of change, a person who is in denial, they're in a stage we call pre-contemplation. That means they haven't even contemplated.
Wow. They're not aware of it.
Yes, they have never contemplated about those options. And what are those options? For instance, the fact that they have dreams, they have wishes, they have desires, and they want to achieve those, and whether or not they're achievable. That by itself is a contemplation, phase of contemplation that people can sit down. We can help each other, somebody who is in denial in that pre-contemplation phase, who is ignoring evidence and facts and kind of in a dream state, dreamlike state, in terms of fantasy-like state about life and very pessimistic, help them expand their horizon, expand their knowledge base, expand their thinking. Look outside of the box, basically. Ultimately, you help them look outside of the box. And the way you do it is not by criticism. You do it by probing, by getting them to think and again, examine things in their lives, even though it may sound very negativistic. So then you may be sitting with somebody and say, so tell me more about this, last 3 days that have been very difficult for you. And they may say, no, I don't want to talk about it. Well, then what you can say, it sounds like it must have been, quite painful for you. And they may say, yeah, it's just horrible, and I don't want to talk about it. I say, okay, you don't have to talk about it if you don't want to. And what do you want to talk about? They may say, well, I want to just think about this project that I'm about to deal with. And say, okay, well, tell me more about that project. Well, what does that project entail? They may say, well, I want to get somewhere. I want to complete it. And why would you want to complete it? Why in 5 days? And so because it's important to me, and I want to impress my boss. Okay, how come? Why do you want to impress your boss? Well, because I want to get that promotion. Why is that promotion important to you? Because I want to get that car. What car is that? Why is that car important to you? I've always dreamt about it since childhood, right? And so you're helping this person to make sense and meaning out of their actions and whatever they like to talk about. Now, and then we say, okay, so is it feasible? You can finish this in 5 days? And say, I'm not really sure if I can finish it in 5 days. And so see, you're getting them to really talk about things that are important to them and help them reason their own way through their daily activities, daily lives. And they themselves are going to come to admit that something is not right in this picture. Sooner or later, they're going to come clean and say, you know what, actually, I don't even think I'm going to make it in 5 days, and I think I'm going to fail at that. Oh, really? Why do you think you're going to fail at that? This is a different conversation.
It's a whole different conversation.
Yeah.
And so it looks like a lot of this stuff needs to be learned by management.
Yeah.
If you're working with people, you manage people, supervisors, human resources, stuff like that.
Absolutely. That's why addiction is a very complex phenomenon that requires a lot of systemic help. And I'm glad that insurance nowadays covers addiction, the treatment of addiction, because that type of systemic help can be delivered through multiple channels. When insurance is there to help, treatment centers can tap into multiple resources. Many organizations and individuals can become available, and the philosophy is changing too. The philosophy of helping treat someone with addiction is moving toward a comprehensive, integral fashion where we bring in family members to do family therapy. We have an individual therapist to work with this person. We help an individual to go through group dynamics in relating to other people, learning from other people. We help an individual to set up what we call a sponsorship system. So they reach out, select a sponsor in the community who has been there, done that, and gone through these experiences and is willing to be there for this newcomer. We help a person to ramp up every other area in their life, such as career building, financial knowledge, legal knowledge, so that all those components need to gradually fall in place for someone to regain a sense of strength, and again, hopefulness and validity and worth, basically self-worth, to appreciate themselves, appreciate life, appreciate the things that they have versus just looking at the things they don't have.
Good stuff. Good stuff. I hope you learned a lot from tips and tools. We're going to cover more on drug addiction. We're going to cover more about prescription drugs, illicit drugs, alcoholism.